The NIH recently awarded a $1.58 million five-year grant to LSU Health Shreveport researcher Dr. Edward Glasscock.
In our lab, we study epilepsy, which is one of the most common neurological disorders in the United States. And in particular, we're interested in a catastrophic complication of epilepsy called SUDEP, which stands for Sudden Unexpected Death in Epilepsy. So SUDEP is defined as a death of a patient with epilepsy who's otherwise healthy, where postmortem examination reveals no obvious cause of death. This affects about 1 in 1,000 people with epilepsy every year, and that makes it the leading cause of epilepsy-related mortality. So one of the big questions in the field is, following a seizure or in people with epilepsy who die of SUDEP, what was the main primary event leading to their death? Was it a cardiac or a respiratory event? And so in our study, we're trying to use some complex in vivo electrophysiological recording techniques in our mouse model to identify, following a seizure or during a seizure, what happens in the heart and in the lungs leading to their death. Is it primarily a cardiac event or a respiratory event or some combination of the two? The thing that makes it unique is that we're able to record so many physiological parameters in an alive mouse at the same time, meaning we're able to record brain activity, heart activity, breathing, and muscle activity all at the same time. So we're one of the only labs in the country that right now that is currently equipped to do these sorts of experiments. So we're hoping that we can translate our findings from our mouse model into the patients by hopefully identifying areas of intervention. Do you need to be intervening with some sort of antiarrhythmic drug, or is there some sort of drug maybe that could be administered that could improve arousal or respiratory function related to seizures? So right now we currently don't know which of those two is more important. So if we could identify that, maybe it would at least narrow down the types of prevention or treatment options that we should be pursuing.